Thank you for taking time out of your busy schedule to be with us today. I'll be speaking on lymphoma. So, we usually see the good side of lymphoma, but lymphoma does have a very difficult and a very, so what do I just call it the good, bad, and the ugly. Lymphoma is mainly basically of two types. You have the Hodgkin's lymphoma, which is seen mostly in children and in the adult population in the older age group, above 60. And we have the non-Hodgkin's lymphoma, which is more common, and it is seen usually in the adult population. So, I'll be doing a case-based study. So, this was a case, a 14-year-old boy who attended my OPD with swellings in the neck for the last 8 months. And he had done some alternative medicine, some homeopathic consultations, he had received some antibiotics, and was not improving. And then when he had come, he had already was developing some B symptoms. He was having fever, he was losing weight, and he was not having the typical night sweats of lymphoma, which is described as drenching night sweats in the evening or at night, which requires a change of clothes. So it was not typically there, the drenching night sweats, but night sweats were there. And he was losing quite a bit of weight. So a true-cut biopsy was done initially, and it was suggestive of a classical Hodgkin's lymphoma. Now, whenever a patient of lymphadenopathy comes, the most commonly that is done is a FNAC. So I'd say FNAC is neither conclusive in any way. It is a high rate of being false negative. And then the other thing is, because you cannot do an IHC on it, and today the basis of all starting chemotherapy and all malignancies, you need to do an IHC. So if you, it really does not help much. You need a total of an excision biopsy, which is the most advised and the recommended in the guidelines. And if that is sometimes not possible, you can go ahead for the true-cut biopsy. So in this patient, when true-cut biopsy suggested a classical Hodgkin's lymphoma, and a PET-CT was done, which showed lymphadenopathy in the supraclavicle, intraclavicular region, in the retrosternal and the mediastinum. So it was localized to above the diaphragm. This was the child, as you can see, for so many months and years that he had remained untreated, and when he was presented, he was presenting with respiratory symptoms to some extent. So this was, because it's more than 10 centimeters, we call it, because it's restricted to one side of the diaphragm, so that is stage 2. Stage 2A, with bulky, because we don't have other, and it was unfavorable based on some of the risk factors which was there. So this is how we do the staging, which is known as the modified Lugano staging, stage 1, 2, 3 and 4. Stage 4 is obviously when it is disseminated all over the body. Stage 3 when it is involving on both sides of the diaphragm. Stage 1 when it's localized to a single node or single lymph node region. And stage 2 when it's more than that. So this, we have a lymph node region, so even it is within the abdomen, it is involved in the inguinal, femoral as well as the iliac, then it goes into 2 lymph node regions. Similarly for your thorax, if it is your hilar, then you have cervical and even infraclavically, and then in the mediastinum, that will classify as 2 different lymph node regions. And then the staging does go up. So, what did we do in this case? For the treatment options that we have for the early stage Hodgkin's lymphoma, we have 2 main therapies now, which is a PET adapted therapy. That is, you do a PET, you give treatment, then you assess by a further PET-CT scan, and then you decide how many cycles to give them further. So we have Dr. Lee, a guy who has presented this case in the classical journal. It was presented by Dr. Hodgkin, who observed the morbid changes which were associated with absorbing glands and spleen in organs. And this was one of the earliest publications of lymphoma. And naming was, of course, after him. This is such a beautiful painting that this has been drawn. Hodgkin's lymphoma over the years, the overall survival has increased significantly from the early 90s till 1990, where now you have almost more than 90% cure. It's one of the cancers which can be very easily cured. It depends, of course, the survival depends upon the stages, whether it's early stage or it's an advanced stage. Early stage, you have stage 1, stage 2 and stage 2A. We consider it early, and beyond stage 2A, that is from stage 2B up to stage 3 and 4, we consider it to be an advanced stage. Now, favorable, it has a chance overall survival is more than 99%. The unfavorable, still, it has an overall survival of around 96%. This has been the evolution of therapy in Hodgkin's, went from transplant for the resistant cases, when in the 2000